Let's go over some supplements that rehab doctors use commonly. In this case, today we'll talk about magnesium formulations. I always break this into two different camps. You have your gut magnesium supplements and your brain and other system magnesium supplements. The difference here is the absorption. So someone's coming to me with some sort of constipation related to either medications like GLP-1s or just because there's someone who's chronically constipated. I go for the cheap stuff, the magnesium oxides and hydroxides usually. There are studies showing that these work well for maintaining bowel regularity. I always go with the oxide at about a 800 to 1,000 milligrams twice daily dose if somebody is acutely constipated, and then I shave that down for a maintenance dose. Everyone's a little different what they need there. Oftentimes it's somewhere around 400 to 500 milligrams twice daily. These work by having an osmotic effect. They keep water inside the bowel lumen to keep stool hydrated and make it easier to expel stool instead of being kind of dried out and firm there. So you need to be drinking enough water when you're taking magnesium for the purposes of bowel regularity. Pairs well with fiber to give you kind of a 1-2 aspect. You have the osmotic effect and you have the fiber that can kind of solidify things and then keep you regular that way too. Now you can get the same GI benefit there with the threonates and glycinates and all those, but they're expensive. So if you can get away with the cheap stuff for the purpose, why not go with that oxide? Now the expensive stuff, the well-designed magnesium something eights. The idea with those glycinate, threonate, etc. is they're better absorbed, and that's why they're more expensive because you get more out of them typically, and they're more expensive to make probably. Those two in particular get a lot of attention now because those are the ones that seem to be best at crossing the blood-brain barrier. Glycinate may have an additional benefit on the sleep side because glycine has some sleep-promoting activities here, so the magnesium and the glycinate may both have some kind of synergy in terms of helping to promote calm and sleep and things like that. Now, threonate, it is also well designed and is researched and studied to show that it can cross the blood-brain barrier and is a favorite of folks who are trying to improve overall brain health by increasing their brain magnesium levels. Of course, we have a number of caveats. Number one, this is a medical advice. Number two, if you were to do something like this, make sure your kidneys are working well enough to manage these magnesium loads here. Blood magnesium levels are not really the best marker for intracellular magnesium and everything like that. So you may have relatively normal-ish levels when they do a blood test, but you may actually need more magnesium in your body than you're able to detect on that test. Another quirk with magnesium is that if you are low in magnesium and you're low in potassium and you're trying to bring your potassium up, oftentimes I just try and get the magnesium up, because that will make it a lot easier for your body to better manage potassium based on the foods you're eating. It's a lot harder to take too much magnesium than it is to take too much potassium. That's much easier to do, and you can cause bigger problems by doing that. Either way, talk to your own doctor because your own medications may cause different issues, and I can anticipate here and explain in a simple short.